Good evening, everyone. Welcome to part two of our Ask the Expert. We will be picking up where we left off, discussing medications and their side effects. Welcome again to Dr. Christie, who has graciously agreed to continue this discussion with us. Evening, Dr. Christie.
Good evening, Dr. Anderson. Thank you for inviting me to come back. And I did enjoy the first one, so I hope, well, I know we should have a nice time again.
Yes, absolutely. And I've had a lot of patients talk to me, and there's lots of feedback based on our last session. So I'm excited to continue. Okay, so jumping right into some of the questions that we missed in our last session. So we were discussing side effects of medications like methotrexate and the steroids. I wanted to know about the methotrexate and the azathioprine, just some practical questions that patients asked as it pertains to meals. Should these medications be taken before or after meals, as it pertains to the methotrexate and the azathioprine?
Well, methotrexate and azathioprine, they can cause nausea and well, GI disturbance. So for medications that cause GI disturbance, you'd want to take them with meals, or sometimes you can take them at bedtime to help, with the last meal of the day, to help reduce those side effects.
Okay, all right, so those medications are with meals. Now, the methotrexate, patients take quite a few of those small tablets sometimes, depending on the dose. In terms of decreasing side effects, is there any benefit to splitting the dose?
Yes, I see a lot of rheumatologists recommend, for example, if they're given 12.5 milligrams, then they would give probably some in the morning and some in the evening. So if they're giving like this one dose weekly, they'll give it perhaps on a Saturday and give a morning dose and an evening dose.
Right. And that tends to reduce some of the side effects we find. And also sometimes we find that it could even be more efficacious when given that way. All right. So another question that we got that we didn't address before is that some patients are on blood thinners like warfarin. What are some of the common interactions that we should look out for, or that our patients should look out for? What can we tell them?
Well, warfarin is a drug given to thin the blood to reduce clots and to dissolve clots. So any drug that increases the thinning of the blood, for example, aspirin is one of the major drugs you'd want to be avoiding once you're on warfarin. Some herbs cause blood thinning properties, and so you would want to check. You have drug interaction tools that can be used to assess because sometimes it's speculation, but it might not necessarily happen. Because even these days now with foods, they used to say before, no vegetables while you're on warfarin. Now they're saying you can have vegetables, and it's now a monitoring situation. So
I see.
But definitely for like aspirin, you wouldn't be giving it with warfarin, because it would definitely increase what they call the INR value and cause more bleeding. So patients need to always consult with their doctors or the pharmacist if they're going to buy supplements, herbals to add to their regimen, and let them assess it, do a profile, a drug interaction profile, because not all things interact.
Right. Yes, so you made a good point about consulting with their doctor, because what I've found is that you may have a lot of these patients see multiple providers. Yeah. And you may have one doctor who has prescribed warfarin, and another doctor who has prescribed an antibiotic. Now, there are lots of drug interactions with warfarin. Now, if the doctor who prescribed the augmentin or some other type of antibiotic, for instance, knew that you're on warfarin, they may tailor the choice of the antibiotic to one that doesn't interact with warfarin, since there's so many interactions. So communication is really important so that we are able to guide you, and if need be, like you said, to do closer monitoring of the INR to see if there is some ill effect.
That's
Okay.
correct. Yes, and also
Right.
what you can advise the patient, just in case something happened and they're on a new drug and there wasn't any monitoring, the patient can look out for extra signs of bleeding. For example, if they brush their teeth and they see they're bleeding red more easily, if they see bruising, then they would know to stop taking both the warfarin and whatever they're combining and consult the doctor immediately. They wouldn't stop and just for a few days. They need to do immediate. It's an immediate action. So if it's in the night, then by morning you contact the doctor, stop the medication, and report to the doctor. Although warfarin tends to be given at night and anyway, these days to reduce side effects and so on. But you would try and contact the doctor as soon as possible and not just keep taking the medication.
Okay, great. Yes, thank you for that very good reminder. Another question. So we spoke about the turmeric and the anti-inflammatory effects. Okay, but are there any negative side effects that are related to the use of turmeric? And if so, what are they?
Well, the studies are not showing any right now. The literature is not pointing to any big side effects for turmeric. I mean, you have individual reactions that persons may complain of, perhaps not liking the taste or the flavor, or they might say, oh, can't. So you have individual reactions, but basically the literature is not pointing to any major side effects. As I mentioned before, most herbs cause blood thinning. All right. And so therefore, anything you're taking can have a potential for side effects. So you as the individual would have to be monitoring yourself. You take this herb, if there's any unusual effects, then that's your reaction. You consult the pharmacist or your doctor to report what is happening.
Okay, so you're saying there's an association with blood thinning. There could be an association with bleeding.
That's speculation, because what you find in clinical practice is not everything that is supposed to happen happens. And then for example, aspirin and omega-3. Omega-3 has blood thinning properties, but it works in a different mechanism of action than aspirin in how it thins the blood. Right. So therefore, it's not going to result in bleeding per se in comparison to aspirin, because they work to thin the blood in a different way.
Okay, I understand. So there will be no issue for a patient who is on warfarin taking turmeric, for instance.
Let me just do a quick interaction for you and see how that plays out.
Okay, right. I'm just going through my mind with, different types of blood thinners being combined together, what's safe and what's not for our patients.
There's nothing wrong with that at all. Curcumin. Okay, well, it's not. You see, some of these information are new, so it might not.
Right. Yeah.
So again, it's monitoring. So if the person, so they take it and then they monitor. And then what you do, go slow. Use a small amount. And so perhaps the best way to use the turmeric would be the tea bags, which tea bags are very low dose. The therapeutic dose is like 4 of those recreational tea bags. So for a person to use a 1 tea bag, it wouldn't result in much great harm, because the doses I was mentioning last time was like 3 to 4 grams remember, of the
Yes.
turmeric. Right.
Right.
A tea bag does not contain anything near that. So those tea bags are not going to result in any harm. And that is why they are for free sale. With pharmacy laws, once things will result in minimal harm, they can be sold anywhere, supermarkets, etc. Right. Once you then go into a pharmacy now to buy like a supplement, those have a higher dosage. So you need to consult with the pharmacist at that point, or or your medical doctor.
Okay. Um, that's great information. So we didn't talk a lot the last time about garlic, and there are quite a few questions about garlic. Is garlic pharmacologically active? And if so, what are its effects? What does it do? That could be positive. What can it do? That can be negative.
Okay, again, now garlic is therapeutically active. You have a lot of studies sometimes coming up saying, oh, garlic, there's no use in cough and cold, or, these studies.
Right, right.
You do see them from time to time, and then you say, oh, you wonder. But this literature is saying now that garlic is active. And I'm going to interact it with warfarin. And right, it's saying here, D, consider therapy modification. So it's saying that garlic with warfarin would tend to promote bleeding. So again, if the person were to still take a peg of garlic, you watch if you see any signs of the gum bleeding. But basically for me, if someone came and had warfarin and I have this tool and I got this, I would say to them, no, don't take the garlic. That would be my advice to that patient.
Right. And of course, this is based on the quantity, because we use garlic as a varnish used in our seasoning. A lot of people, we eat it all the time. So I'm assuming that with those quantities, there generally is no harm. Am I correct?
Yes, because once you cook garlic, the activity is decreased. The allicins and those agents get destroyed basically. So you will have other properties there, but that blood thinning effect, because what they really have found too is the aged garlic that has more therapeutic action with the blood thinning and other effects. Yeah, the aged one, they call it garlic, I think, garlic.
Right.
It actually turns brown. That has more of the action. But
so in terms of the therapeutic effects of garlic, is it also an anti-inflammatory like turmeric?
It's anti-inflammatory, it's antibacterial, and it's antiviral. And in the past, traditionally, it was used for vaginal candidiasis. Persons used to make ovules with it, put it in cocoa butter and insert it for those type of uses. Persons make airdrops from it and put in the air. Some even just probably rest the garlic in a cotton and put it in the air, and it helps with the air infection. So it has antibacterial, antiviral effects. It is anti-inflammatory, but to be honest, I have not really seen any studies that compare those together. But turmeric has much more anti-inflammatory, and at the doses I was telling you, it's equivalent to, I believe it's 400 or 800 milligrams of ibuprofen.
Really?
Yes. Now garlic was never compared like that, so therefore turmeric has more anti-inflammatory action and pain-killing effect than.
Well, if it was never compared like that, maybe we don't know.
Possibly, that is true. That is also true. And then it's the dose, really. Remember, it's the dose that always determines how much of the garlic would be used to get effect. And they've never really done that, to be honest.
Okay, so there's a lot to learn in that area.
That's right.
Okay, very interesting. So what about fish oils? We get a lot of questions about fish oils.
Omega-3, as you know, also called, they are anti-inflammatory also. Now, how they work with the anti-inflammatory is because of their antioxidant potential. They're actually antioxidants. And so there was a cardiologist in Jamaica, a renowned cardiologist. They actually did a study, and they found that once you have a heart attack, because of the study that they did with these patients, if you take the omega-3, it prevents further heart attacks compared to the other group who didn't receive it. And so his take was, once a person has a cardiac issue, omega-3, and it's not dangerous to the individual. It's a very safe product to take. And also studies are finding now too that when you take it, it also prevents the cholesterol plaque, the LDL triglycerides, from becoming sticky. And that's how it prevents the stroke, or, and they're wondering how it works. So when you have high cholesterol levels and you're taking omega-3, you don't end up getting a stroke compared to those who don't. And it's because of that antioxidant property where it prevents the plaques becoming sticky, oxidized, and then clumping together and forming clots. So omega-3 is very good like that. It also has hormonal action. It helps with hormone function. It can be used to burn fat. People can take it, but then it's the flax seeds that they blend and make the powder that would add fiber and help to burn fat. So it has quite a lot of, and it's anti-inflammatory. What they're using now is 6 grams, 2-3 times daily at that maximum dose is anti-inflammatory, and they say it has some anti-cancer effects too. At the high doses, yes. So for like lupus patients, you'd be given like 2-3 times daily at the maximum dose to get the major anti-inflammatory action.
From the omega-3s.
Yes. But when I did interact with warfarin, it comes up with a C rating, monitor the therapy. So even though it has the blood thinning property, again, as I said, probably it's more from its antioxidant action, why it will thin the blood, in that it prevents the clogging of the arteries with the plaques once they become oxidized, the LDL and triglyceride fractions.
Okay, so it's a contraindication to taking it. You just have to, like you said, monitor it more closely.
That's right.
Okay, so that was great information.
Thank you.
The patients love to ask about fish oils. And I know some things, but not as much as you do. So I'm learning as well.
Well, thank you. Well, it's the course I did an integrative health and medicine course. I'm a fellow in that, and it helps you to learn so much. It's evidence-based information, so I'm glad I can share it,
Right, and we're so happy to have you. So another question is that now we have a lot of our patients seem to be afraid to take statins. Now, what are some of the concerns with taking a statin? And when I say statin, for those who don't know what I'm talking about, medications like simvastatin, torvastatin, rosuvastatin, those are all in the family of statins.
Okay, well, those group of drugs are being used to control the cholesterol level. Okay.
Right.
Right, and they primarily are metabolized and work via the liver in how they act. So because of that, before persons understood everything about statins, just like with COVID, everything's evolving, right? They used to find that persons had a lot of muscle pain, but they call it myalgias, myopathy. And at first they were saying, okay, we need to monitor the drug. I believe it was every month at one point, or every 3 months, to see what was happening with the liver enzymes. And then we would know how to take the drug off, because they thought how it affected the liver enzymes was what contributed to the myopathy or the muscle pain. But what they're finding now that it has nothing really to do with the liver function, but it's actually more of a genetic disposition. So it's not everyone who takes the drug is going to end up with muscle pain. And, and then what they're finding now too, it's more the giant Chinese, the Asians who tend to have the myopathies more than say our Negro population or the Caucasian. So the studies are coming out more and more. The only thing with statins now is they're also finding out that because of how they work, this nutrient coenzyme Q10, which is needed in the body to process a lot of, in metabolism, becomes deficient. And that can also contribute to the muscle pain. So once you're on a statin, you need to supplement with coenzyme Q10. Also, other nutrients might become depleted, which not only is because of statins, but other medication can cause depletion of nutrients too. Another nutrient you'd want to supplement with, I think that also there might be studies showing that they cause bone fracture too, the statins. So therefore, persons who are at risk for osteoporosis, the doctor would have to now be monitoring for the bone density tests, But apart from that, those are the most, it's the myopathy, the muscle pain that is attributed.
Right. Yeah. So, the statins can be very important for our patients because cardiovascular complications are one of the major causes of mortality in our population. And so the patients do need to know that sometimes these medications are necessary, they are safe, and they're effective. And what I've found is that you do have some patients who may have myalgias, but there are differences with one statin to another with that effect. So we do find if you have this issue with one type of statin, if you speak to your provider, you could change it to another one that is less likely to have that effect. But you still have the important effect of protecting your heart. Okay?
That's correct. And also for diabetics, studies show that it has some kidney protection too. And so they give the statins. Sometimes it's not because you have any cholesterol issues, but it's a preventative safety thing that doctors are doing. So some doctors give low dose. I've heard where in the US now, they're even given statins once weekly. I don't know if you've come across that, Dr. Anderson. So
I have not yet.
Well, they're giving it once a week, in some areas. And cardiologists, these are integrated cardiologists. So yes, you're right. Sometimes you have to take these medications, but again, coenzyme Q10 supplement so that the risk of the side effects will be reduced.
Right. Okay. Yes, so that's great. Now, calcium. So you mentioned something about fractures for the risk of osteoporosis, which is really multifactorial. It's usually never just one drug that puts a patient at risk, but multiple agents. So many times we do have to put our patients on calcium and vitamin D. Are any kinds of calcium better than others, or some forms of vitamin D better than others?
Okay, well, you have different types of sorts of calcium. You have calcium carbonate being the most readily available, and it's the cheapest form. It tends to have
and that's Tums, right?
Yeah, Tums. It tends to have the highest amount of elemental calcium. So for example, if you say on the serving label, it might say calcium carbonate is 40% of this elemental calcium. if you have like 1,250 milligrams of the calcium carbonate, that will give you 500 milligrams of the elemental calcium. I know that's a bit complicated, but basically it's just telling you how much is available from the amount. So you'll have a large amount of a drug, but it's only this small amount that is actually available. So that's what that was its meaning. So calcium carbonate more readily available, but for some persons, it's the more constipating form. So a lot of us might take and get a lot of constipation from that form. Some of them can have different side effects like gas, bloating, etc. As I said, calcium carbonate is the most constipating form. There's some ones that have a better absorption. So for example, the citrate, calcium citrate may give a better absorption. There's some doctors who say glycinate. I don't know if we have that in Jamaica, so we have to stick with what we have. So calcium gluconate is another form that might be more absorbable. And then there are some persons who, because of their age, and if you, for example, if you're taking proton pump or anti-gas medicines and have low stomach acid, for example, if you're over 50, then calcium citrate is a better form for those persons to take because it will be better absorbed. So if you're not producing enough stomach acid, you're over 50, then calcium citrate is best absorbed for those individuals. So you do have different forms of calcium. Some may have different side effects, but as you were mentioning, everyone needs to test it out for themselves and see which one works best for them. So the doctor would see which one works best for the patient. And if it's not working enough, if there's some side effects, you can switch to another brand to see if that is more tolerable.
Okay. All right. So it's kind of something that we could play around with.
Yes, that's right. You were asking about vitamin D. You were asking about vitamin D, right? Now, vitamin D, what they're promoting nowadays is the D3, okay? And the brand really sometimes is important. You have different presentations. So the vitamin D will be an oil placed in a gelatin capsule, and that would help to promote absorption. Now, you do have some preparations that are more vegan, so meaning vegetarian. So the container, if you'd like to use a better word, would be made from a special coating.
Okay.
Sometimes you have vitamin D being obtained. We know vitamin D tends to come from fish source, right? So for vegan now, they would get it from lichens, L-I-C-H-E-N-S, a plant. So you have plant sources, which will be better for persons who don't want any animal source. Then you may have them packaging the vitamin D in a liposomal complex, that is in a fatty substance. So they have these fatty spheres that surround the drug. And so therefore, this liposomal or this form of vitamin D is more readily absorbed. And what is being found out right now is that vitamin D works best with vitamin K, which we don't normally think about much. So you will have preparations of vitamin D with K1 and vitamin K1 and K2. But the vitamin D, what they're finding out now, which I found was interesting, is that it's not just a vitamin, but it's hormonal. So it has hormone properties. And remember, it's good for the coronavirus because it's actually building the immune system. That's how it's now become popular with treating COVID-19 or ensuring that your immune system is up. And because lupus sufferers tend to have this problem with clots, vitamin D3 is found now to thin the blood too and prevent clots. And that's why it's gained such a momentum during this COVID-19. The studies are showing now that it helps with clot prevention, and quite a lot of other benefits. It's not just a vitamin, but it's now a hormone.
Right. Okay, so patients, family are not just hearing it from me or from other providers, we're hearing it from Dr. Christie. Your prescribed calcium and vitamin D, please take it.
Yes.
Very beneficial. Okay, well, Dr. Christie, I think we finally covered all the questions that we had. We needed 2 sessions to do it, but it's been very informative, and so we appreciate you partnering with us for this episode of Ask the Expert.
Well, Dr. Anderson, I just wanted to preempt because I really enjoyed the researching for all of this. You wanted to know about pregnancy and whether lupus patients could take contraceptives.
Oh, yes.
That was a question. Right. So what I discovered is because the contraceptives tend to cause a lot of clots and problems that would make lupus worse and even cause flare-ups, the studies are showing, then what we would want to recommend is probably the mechanical forms of contraceptives, like IUD, with the copper intrauterine device. I know Jamaicans don't love those things. They tend to prefer the oral, but the IUDs would be probably more suitable for them, or the diaphragm, things like that, rather than taking the contraceptives. That's for a pharmacist's recommendation. Of course, they'd have to more work with their doctor, who will then advise them and then have to monitor them to check out for side effects.
Right. Well, yes, those are options. Now, there are some lupus patients who do have a specific predisposition to clotting. Some patients do have a condition called antiphospholipid antibody syndrome, but not all patients have that. And with birth control, of course, there are different formulations, and some may be more pro-thrombotic than others.
Yes.
And so what we say is it does depend on the specific complications you have. In your lupus, do you have antiphospholipid antibody syndrome? Have you had a history of actually having a blood clot in the leg or in the lung? That would guide us, but there is no real absolute contraindication to birth control. We would just have to be more careful about choosing what type. So please have a conversation with us about it so that we could guide that process. And of course, the pharmacist and the obstetrician as well would be important in that dialogue.
Right. Okay. Yeah.
Okay. All right. So I was prematurely wrapping up before, but I think we already know, Dr. Christie, there's not anything else I missed.
Well, I would love to talk a little bit about the pregnancy because, some persons might be wondering if they can get pregnant, and I found that, yes, they can. They might have more complications than someone who is not having lupus, but they can have, they can be pregnant and have a baby, but they just have to work with their rheumatologist. And
absolutely,
that was a concern that persons might be worried about,
Absolutely, absolutely. We've had many patients who conceived and carried their babies to term successfully. Okay, what's important is planning. Okay, when you have a diagnosis like lupus, pregnancy really, perhaps it should always be planned, but especially more so when you have this condition, because we recommend that you have disease control before you have a baby. So for 6 months, there really should be very low activity or no activity, so that we know when you go into your pregnancy, you're going into it with as healthily as possible. Okay.
And isn't there
Yeah.
some medication they might need to stop, doctor? Some of the medications depending, so they have to work with their rheumatologist, you know.
Right.
Sure.
Excellent point. And this is where again I say planning, because there are some medications, and we spoke about some of them in the previous episode, that are unsafe in pregnancy. And so we may have to switch you to medications that are more compatible with the pregnancy and
Yeah.
that are safe. So a conversation with your rheumatologist, with your obstetrician is very, very important. And there are options. We do have safe options for our patients.
Right, great, thank you. I think that's it. I can't, I don't have any more to bring up.
Okay, no problem. All right, so thanks everyone for joining us. Thank you for all the questions and making this such a vibrant interaction between myself and Dr. Christie. And we hope that you learned a lot. Remember, for those who are not members, we do have a Lupus Foundation of Jamaica. Please join, please support, please donate, so that we can assist our lupus warriors and their families as best we can. All right. So have a good evening, everyone. Stay safe.
Bye.